Okay, so we all know the horror stories, we all know all the terrible things that can happen with lashes, but let's hear what a doctor has to say. What's up guys, welcome back to my channel. My name is Ariel, if you didn't know. So today's video is gonna be so different from any other video that I've done so far, but it is so exciting. I have a doctor here to talk to you guys, answer questions that we all have, and really lay into the details that we need to know as lash artists. So we go over everything from what to do when you suspect an allergy, the do's, the don'ts, and basically the things we talk about on a doctor's perspective and just what they think about lashes. To be honest, we all know that there is a huge stigma between lashes and optometrists. If you've gone to an optometrist and you've had lash extensions on or you've had a complaint, you already know your optometrist is like, get those off your eyes, because they do not support this. But I have an optometrist here that actually thinks that there's a middle ground and that there's something that we can do to kind of merge the two together and just do things the right way. So let's get into it. Okay, so I'm gonna let Dr. Natalie Chai go ahead and tell us a little bit about herself and where she's from, what she does, and what she knows.
Great, so a little bit about myself. I guess I can start with some credentials. I graduated in 2014 from Pacific University College of Optometry down in the Portland, Oregon area. Go Boxers. And from there I came back home in Edmonton, Alberta. That's where I am right now, and started to practice. At the beginning, was practicing almost in every modality everywhere. It was a lot of work, but it did teach me a lot about what I liked about optometry, what I didn't like, and here I am. And for I think the last 8 months, I became a partner at an office here called Precision Eye Care, founded the Dry Eye Center and other specialties. I still see a lot of the routine exams from the young kids at 6 months all the way to our fantastic seniors. A lot of different variety. But my eventual goal is to be super focused in things like dry eye disease and the other specialties that I offer. So that's a little bit about who I am, and I guess my credentials are on there.
Thank you so much, Natalie. So let's get into question 1. So what are some general concerns someone in your field would have about lash extensions? Let's be real, we know it's a touchy subject, so what are your thoughts on this?
Yeah, so eyelash extensions seem to have a bad rap, especially in our community among optometrists and ophthalmologists. But I think the reason for that is because we just see the bad cases, right? Not to say that we don't ever see the good stuff. I've seen actually a lot of good work, especially when we're looking underneath the microscope. I do see kind of where the placement of the lashes are, and good and bad, but most of the time what we see and hear in the news are the bad stories. But in the general sense, what we are always kind of taught to look for and what we are asked to be aware of when it comes to eyelash extensions are number 1, swelling of the lids, the top and the bottom, of course. 2 is skin irritation. So sometimes the allergy or the infection as well can permeate through past the lids and around the eyes. 3, as I mentioned, infection of the lids and even of the cornea as well, which is the clear part of the front part of our eye, and sometimes corneal abrasions. So it's essentially like a scratch on the front surface of our eye again. And the other part that we do have to want to make sure of is or want to be aware of is the temporary or sometimes even permanent loss of lashes, especially for those patients, I guess in your sense, clients, clients that are long-term users of eyelash extensions and they don't seem to take a break from them. So those would be the generalities of complications that we watch out for.
Okay, those are super important tips to actually know and be aware of, that this is something that we could cause or we could be harming our clients from just by doing what we do. So this is exactly why we need to know these things before we go ahead and lash a client. And we also need to know these things in our training so we're aware of how to avoid situations like this, because once again, this is something that's super important and something that could really harm your client. Okay, so in your opinion, what do you think people should be aware of, or what measures do you think they should take before actually going and getting their lashes done? And what do you think lash artists should be aware of before actually taking a client?
Yeah, so for me, I guess I can sum it up in just one word, but I'll go into the details for sure, is prevention. So preventative medicine is something that I truly believe in. It is our best medicine when it comes to anything in life. And just preparation beforehand, doing the work beforehand will just save so much stress and complications and money and time down the road. So when it comes to eyelash extension, it's super relevant. And one of the biggest things, I know that you have talked about this when we had our chat together, Ariel, is lids and lash cleanliness. Because the one thing that we see a lot in our clinics every single day is something called blepharitis, right? So blepharitis is Latin. Itis just means inflammation. Bleph is, of course, Latin for talking about the lids and the lashes and the structures around it. And so what it looks like to us when we look underneath the microscope is there's many different types of blepharitis actually. And there's ones that would look more like dandruff, so they would have that flaky look to them, so it would actually go through the whole length of the lash. Another type is more of that oily look to it, so it does have more of a sebaceous or oil basis to it. The third is actually something called Demodex. So Demodex is, it's a mite, infestation of an over infestation, I should say, of the lids and lashes. And it's kind of gross, it definitely is, because they do live in our hair follicles and that is their favorite place to be. It's like the perfect environment for actually any bacteria because there's the oils, because that's what they eat. 2, it's warm, right? And 3, there's the hair follicles. They love to nestle or colonize in the hair follicles and also make their babies there too. So so that's the one thing, of course, that I always encourage is to hopefully your patients, your clients, I keep saying that, sorry. Your clients already have some semblance of a good lid hygiene regime.
Okay, amazing. It's so good to hear you say that because that is something that lash artists, we always preach to our clients, right? That's something that we talk about constantly, but it's really nice to get a breakdown of what we always talk about, lash mites and things like that. So comparing the blepharitis and having the lash mites, I think it's really cool to hear what it really is and why we need to basically keep telling our clients and reiterating to clean your lashes and why it's important to have a proper hygiene routine. It's not just about the look of lashes. So I'm glad that you mentioned that. Okay, so in terms of lash extensions and the lash artist, how do you think a lash artist can identify a client that has a problem or an issue with the lash extensions, such as an allergy, an infection, or just an irritation?
This is a great question because the way that I see it is there's 2 sides to it. The first one, of course, is I always say work off of the reaction and the responses of your client, especially during the session and even after the session too, and see how they feel. But here's the caveat to that is I know that for a lot of women when it comes to beauty, they will power through it. They would rather, of course, look beautiful, which there's nothing wrong with that, but they would rather look beautiful than, of course, see what's happening, especially if there's any irritation or pain. And the thought behind that is that it will get better, it will go away. But at times, that's not the case. It will actually get worse. And that's, of course, where those horror stories come around. The thing for the lash artist to watch for, again, I can summarize this into red eyes because the eye will become red, be it an allergy, an infection, or an abrasion, right? And so that's the number one thing. So the white part of the eye, which is of course the sclera, there's always a natural tinge of red to it, but if it becomes, of course, beet red, that's something to explore further as to why is that client's eye red. Allergy, when we're talking about allergies, now we're looking for more of that puffy look. The top lid and of course the bottom lid as well. So puffy lids, I always say look for that sausage look around the upper lid and the bottom. Not only will the lid swell up, possibly actually the whole eye, to the point where it will actually swell up so much that it's going to close that client's eye and they can't open it. So that's something to also be quite in tuned with when you're looking at your patient. The other thing too is, of course, itchiness. itchiness of the skin. So there's of course that the bumps when it comes to, hive looking areas of the skin. The other thing too is corneal abrasion. That is where of course there's a scratch along the cornea. So with that, there's going to be a lot of pain. So that one is where you will know something is wrong. And typically when there is an abrasion on the inside of the eye, the patient will start, of course, to tear lots. So increased watering or tearing of the eye is usually a protective reflexive response to any foreign body. So those are the things to watch out for. When it comes to infections of the eyelids, it might not happen on that day, but what the client might experience is a bit of discharge. So discharge usually signifies some form of infection, especially if it's bacterial basis. But a lot of times when there's an infection of, again, the lids, that's where, of course, it's that the swelling, the redness, the sausage look. Sometimes there can also be residual bruising around the eye too. So those are things to watch out for as well. It's a combination of listening to your patients, but sometimes that's not accurate, as I mentioned. It's always just being in tune about what you're seeing and addressing it.
Okay, so let's say a client unfortunately does have an issue and there is a problem. What do you think a lash artist should recommend, or what is the recommendation that we should be giving our clients in that situation?
Yeah, another great question. It's about solution seeking and what to do in the event that your client who is on your bed, on your table, is that the right term? Sorry, for me it's in my chair, so hopefully I use the right term. But yeah, if it starts happening in that moment, what should you do? And I think the easiest thing to do is actually just remove the lashes, and with it, of course, the glue for sure. And just to kind of take away what is causing and triggering the reaction. That's the safest thing to do. Now, if it gets to the point where you're noticing, or if the client comes back and you see that, yes, there's a huge reaction, I would then, of course, just point them to their optometrist in the city. If they don't have an optometrist, because most optometry offices do take emergencies immediately. I always, and it's one of those battles that we always try to educate our patients about, is that if there's an eye problem, you go to the eye doctor and not a mediclinic, because the mediclinic sometimes is unable to triage very well. There's a lot more serious things sometimes that are happening. And so to cut down on the wait time for the patient and to decrease, their discomfort, is to go straight to an eye doctor.
Okay, so that's actually really good to know. I know we read a lot of blogs and a lot of lash groups and stuff, and people say, go to a doctor, but I think it is important to reiterate that don't go to a walk-in clinic. Make sure that you go to an eye doctor, because that's your specialty, and obviously that's where the issue is. And then at that point too, of course, like when you're in a situation like that and your client is coming back to you and asking you the questions of what to do, that is really when you definitely let your client know. You go to an eye doctor. You don't recommend what to do. You recommend going to see someone who will better know how to help them. Okay, so in terms of do's and don'ts, I do want to hear what you think your general do's and don'ts as an optometrist would be for a lash artist, and what you think we should focus on.
This is a great summary question, and it was honestly pretty hard for me to choose. At the end of it all, I did choose my top 3 do's and top 3 don'ts when it comes to lashing from my perspective. And the first do, and I think you would agree with me, Ariel, is just, again, I'm gonna sound like a broken record, but it is going to be the best prevention and to eliminate, almost, hopefully, the risk of infection and allergies, is cleaning your lids and lashes. Again, prior, but also during, when you do have your set of lash extensions. And I think, actually, you can correct me if I'm wrong, Ariel, is I think you do encourage your clients to clean their lashes. And I understand sometimes for women, especially if it's a fresh set and it looks beautiful, you don't want to just interrupt them. You don't want to make them look bad just by cleaning them. However, it is pretty necessary when it comes to the overall health of your lashes. The second do is for the lash artist, just to make sure that you do your due diligence when it comes to knowing your ingredients, knowing your products and what they are made out of. from my understanding also is that the regulations is unfortunately not there when it comes to the ingredients, especially with the glue. Things to stay away from, of course, is formaldehyde and latex. Latex, obviously, for those who have a latex allergy, which is a lot of people I've been finding. And formaldehyde is just a really strong commercial glue. And the fumes from there is quite, I don't think it's, I don't know if the word is too toxic, but it can be quite harmful, especially if it is in excess to the eyes, in and around the eyes. The other thing that I read up on too is actually some salons use nail polish glue, which is crazy because I know I've obviously had my nails done, and yeah, the fumes from that, I can't imagine it being around the eye. So just knowing your ingredients and just maybe moving away from a commercial grade glue over to more of a medical type of glue, which are out there. And I haven't watched your video yet, Ariel, but I know that you did a good job with all your videos so far that I watched, is just to be more aware of that. The last do, number 3, is I would also encourage, as well as the lash artists, to encourage your clients to take a break sometimes from having lash extensions. Your eyelashes are really delicate things, and they are alive. There's a lot of nerve endings and nutrients going to them. And just a fun tidbit is one eyelash gets to its full length, grows to its full length in about 10 weeks. And the replacement of each lash is about 5 months. Let's say 6 months. It's easier to remember that way. And so if someone is quote unquote, addicted to lashing, it's always nice just to give your lashes a break. In terms of timeline, I would say about 10 weeks. Allow that lash to grow to its full length, because then it would probably, I would imagine, be easier for the lash artist to apply the lash extension on a fully grown lash. And the other part of it too is just less chances of breakage. So when there's breakage, when it comes to corneal abrasions, it can unfortunately get into the eye and cause a scratch.
I think those are amazing do's. I think that they are super in line with what us as lash artists would recommend to our clients.
And the last part, which is the 3 don'ts when it comes to lashing. The first one is we've had a really good conversation, Ariel, around having your client not come in wearing their soft contact lenses to the session. And the reason behind that, of course, is the fumes. There will always be fumes from the glue. Is that sometimes, soft contact lens is super absorbent. So they will absorb basically anything in addition to fumes and gases. And what can happen, of course, is that unfortunately, if the client's eyes don't close all the way, is the fumes can, of course, get underneath and it can soak in the soft contact lens. So there you go. It's a perfect environment for allergies, burning, stinging red eyes. And it can even also change the shape and the make of the soft contact lens. So always have your patient, of course, take them out. I would even encourage them to maybe even just bring their glasses with them, because of course, even after the session, things are fresh, there are still fumes. And I personally, being more conservative, is have them wear their glasses out or have a driver with them, and maybe wait about a day until they put in their soft contacts again. The second don't is, and again, you have fantastic videos on this, is just don't have the lash extension at the base of the lash. Again, it's just about having that direct contact of that glue, blockage of the lids and the pores around the lash line. And of course, just the irritation. Sometimes when it's just rubbing against the eye, that can also cause a lot of irritation and discomfort over time. The third one too, which is tough, and I personally had to learn this myself as an optometrist, is that you are the professional. They are trusting you when it comes to this process, and at the same time, you also have that responsibility to make sure that their eyes are healthy, in addition to beautiful, right? So, and I understand some of the demands from clients at times that they just want things done with no regard to health and whatever, they just want the end result. However, as a lash artist, if you see something that is of concern, when you're looking at them, is just to set the expectation right and don't always cater to the demands of your client, because sometimes what can come back at you from the back end will be so much more frustrating and annoying and cause more heartache because you know, again, for me, what I did was I catered to that patient for me, and I didn't become that professional. So yeah, trust in what you see. It is okay that you don't do, you know, the session for them on that day if something goes wrong. They may be a little bit irritated. However, in the long run, it will be a lot more healthier for them and happier on both sides.
Yeah, I'm actually so happy you said that. I think those three are the main don'ts. I think that, again, being a lash artist, you can definitely relate to something like that and know that sometimes. Okay, so we had some great questions today. You answered some amazing questions and really cleared up a lot of things for us. Is there anything else that you think you'd want to add? Any final thoughts you have?
Some finishing thoughts. First of all, thank you, Ariel, for connecting through Instagram and putting forth this great topic. Lash extensions, I think, is just getting more popular as we go, and it's beautiful. I'm considering it, you know, at some point probably for a special occasion, right? And the bad rap that it has, I think we've had a conversation together, is that it's just not talked about as much as we'd like. The conversation about the ingredients even beforehand and what we can do before when it comes to prevention is not talked about. And so it's great that you have this platform with your channel and with your YouTube videos, is just to educate people, and I really appreciate that. So thanks again for this opportunity. And but yeah, lashing, honestly, there's good and bad, and hopefully with these videos like this, with your videos and just more education, is that the occurrences of any allergies, you know, infections, just we continue to see them go down, and that's possible. You know, it has to come both ways, two-way street, from the lash artist and of course from the client's perspective. Things will probably still happen, but our responsibility is just to do what we can, which is just to educate and just be that professional. So thank you again, Ariel, and hopefully we can collaborate again in the future.
Thank you so much, Natalie, for coming on my channel. Thank you so much for collaborating with me. I really appreciate you going out of your way and answering these questions for us. I think it was so important that we did something like this, and we definitely have to do another collaboration. So if you guys want a part 2, please comment down below and let us know, and I will get Natalie back on my channel. So if you guys want to find out some more information about her, she also has a YouTube channel, so I will leave all her info in the description below. But please hit her up if you have any questions. I'm sure she'd be so happy to answer them for you. Okay, so that is it for today. That is it for this interview style. Thank you guys so much for watching. Don't forget to like, comment, share, and subscribe, and I'll be back with something new next time. Bye!